To the COVID-19. Hello, and welcome to the COVID-19 Vaccines, Parents and K-12 Q&A webinar. My name is Deja Gant, and I am student intern in the Louisiana Department of Health's Office of Community Partnerships and Health Equity. This webinar is being done in collaboration with LDH's Office of Community Partnerships and Health Equity, the Governor's Health Equity Task Force, and the Louisiana Department of Education. Further, the Office of Community Partnerships and Health Equity is devoted to increasing the citizens of Louisiana, in particular, vulnerable communities and populations' awareness and readiness of COVID-19 information regarding the virus and vaccines. This devotion spurred the creation of the office's COVID-19 Conversation Series. Today's event is the 9th webinar in that series. So at this time, Mr. Ken Bradford, the Louisiana Department of Education's Assistant Superintendent of Career and College Readiness, will share a few words.
Good evening. My name is Ken Bradford, Assistant Superintendent at the Department of Education. And on behalf of the State Board of Elementary and Secondary Education and State Superintendent Dr. Kay Brumley, I'd like to welcome you this evening. We'd like to thank the Louisiana Department of Health's Office of Community Partnership and Health Equity for inviting us tonight and hosting the event. Last summer, we released school reopening guidelines that established the minimum health standards for school systems. And because of those guidelines and the strong partnership that we had with the medical experts in the state of Louisiana, Louisiana was ranked number 7 nationally for the highest number of students returning to learning this last academic year. We look forward to a successful school reopening in the fall of 2021. And being part of this evening's discussion and learning from our state's medical experts. Thank you again for joining us this evening, and we look forward to tonight's panel discussion.
Thank you, Superintendent Bradford. Now, we will have the Office of Public Health Assistant, Secretary Kimberly Hood, to give our welcome.
Hey, Deja, and thanks to all of you for being here tonight. Again, my name is Kim Hood. I'm the Assistant Secretary for the Office of Public Health. I want to welcome you on behalf of the Louisiana Department of Health and my colleagues who have done a wonderful job putting this together. I'm also the parent of 5 fully vaccinated children, and I'm really looking forward to having them in summer camps and back in the classroom in the fall, as I suspect many of you are as well. Also, I'm not sure if you've heard today, but not only are students aged 12 to 17 eligible for the COVID vaccine, but effective today, they are also eligible to register to win a $100,000 scholarship every week in July. And with some 5 scholarships being pulled on the final date in August. And you may have seen our very own Dr. Joe Cantor, our state health officer, who's also a panelist here tonight, out announcing that with the governor. So it's been an exciting day for us at LDH. Hopefully everybody else is excited, but really the most important prize for getting your kid vaccinated is just a return to the classroom, a regular year, those extracurricular activities, all the things that kids missed in the early part of last year. Again, you know, hats off to the Department of Education and all of the public health teams in the state that helped get so many kids back in the classroom last year. We want to continue that again. I'm profoundly grateful for everyone who joined us here tonight, and especially for this group of panelists. It's an absolute medical dream team. They can answer all of your questions about vaccinations. I bet they've already anticipated most of them because they've been doing a lot of preparation to get ready for tonight. So you're in excellent hands. We appreciate you being here, and I look forward to learning alongside all of you. Thank you so much.
Thank you, Assistant Secretary Hood. We will now hear from Deputy Director of the Office of Community Partnerships and Health Equity, Devondra Brown.
Thank you, Ms. Gant, and thank you all for joining our COVID-19 Vaccines Parents and K-12 Question and Answer webinar. Before I turn the session over to our event moderator, I want to thank each and every one of you for joining today's conversation. I hope that you find the information here today useful and applicable to yourself and your families. So without further ado, today's moderator is Dr. Sanjay Genesia. Dr. Genesia, better known by his social media handle, the Doc, is a triple board certified hematologist and medical oncologist. His TikTok was first popularized for idiosyncrasies and comedic anecdotes about the medical field and has become a destination tool for blood and cancer-related education. He currently lives in Baton Rouge, Louisiana with his wife, Dr. Lauren Genesia, who shares the same 3 specializations and their 3 wonderful children. Wow, what a power couple. Without further ado, Dr. Genesia, you have the floor.
Thank you, Ms. Gant, as well as Superintendent Bradford, Assistant Secretary Hood, and Mrs. Brown for starting this event, and especially for everybody being here and taking the interest in our community health and wanting to really be empowered with education. I think that's such a big part of what makes a community strong. And for each of you, the community members and the stakeholders who took the time out of your really busy day to attend this important discussion, from all of us on the medical side, as well as Louisiana Department of Health and the school board, we really deeply appreciate you. In this webinar, our hope is that what you hear, you'll find useful and, as we said, empowering and encouraging. We really want people to leave the conversation ready to protect themselves, feel comfortable about their decisions, and protect their families and their communities as we all live together in Baton Rouge and Louisiana. In light of COVID-19, this webinar, we're here to basically gather information and hear information about the facts as it relates not just to COVID-19, but also its vaccinations and how community members are feeling towards the COVID-19 vaccines and anything we can help educate to change those feelings and be enthusiastic about really what it has to offer. We have very trusted gatekeepers from around the state who will lead and be part of this discussion. And I'm beyond humbled and honored to be able to participate and hear everything they have to provide for us. But right before that, we're going to go ahead and talk about briefly just the outline. We're going to have an introduction and a welcome with everyone that's on the panel. And then we'll kind of just go right into the panel discussion, where I think a bunch of the questions are a lot that people are asking and really interested to know. And at the end of the day, the takeaways that you can share both, with your family and anybody else that's asking us now, and hopefully more educated person on both the COVID-19 aspect as well as the vaccinations and what it can do for us. The objective, is basically just to increase awareness and readiness for vaccine utilization in our community. And it's important that everyone knows, everyone in Louisiana ages 12 and older, until our update that was provided by Ms. Hood, are eligible to get the COVID vaccines. And this is a very important point because I actually have some friends that are doing some away rotations at LSU from other countries. Louisiana or US citizenship is not a requirement. And really the concept behind that is just having the community, as we all interact with one another, protected and hopefully decrease the chance of a flare. Some of the facts about COVID-19 is the information aspect, to where we can get up-to-date and accurate information from, again, incredibly credible sources, pardon my redundancy, as it relates to COVID-19, and the vaccination course, which again is 12 and older, but those guidelines are being more expanded. The prevention aspect, which I know we've heard a lot, and it's really been effective, both how you see on, the COVID numbers, but also what you see with flu and other viral illnesses. It's because of all of you guys and everyone in the community, guys and women, that make us really keep this thing at bay. And so we're talking about things like masking up, social distancing, washing hands, the things you guys and ladies are very familiar with. And then, what we hope to take away also is to kind of share the things that really make us as a medical community and people in public health feel that it is an effective and safe means to be able to engage with one another and have that kind of socialization. So these facts are the ones you're going to hear throughout the webinar. And right now we are planning and hoping to lay a foundation additionally with this panel discussion. But before we move on, I just wanted to stress the importance of getting information from trustworthy sources. The internet is an amazing tool, and it's really equipped a lot of people with knowledge they may not be able to find beforehand. But at the same time, there isn't any kind of like policing or basically guidelines like you see in journals for that information. So we want to provide with you very supported, literature-based, database information, so that when you share this information pertaining to COVID and its vaccines, you're going to feel really supported and know that it's coming from a legitimate study. And so websites like the Louisiana Department of Health and the CDC, that's stuff that we definitely look at the data for before we present it. And those are the things we want to share with you, as well as a one-pager via the email, which is why we ask for your email address after the session. So you really have those facts and information available to you to share. And, we really feel like sharing the correct information, not just feel, but shows it really does help save lives and even morbidity, just from some of the things that may not on a data paper look like, oh, death from COVID, but still have very serious consequences like blood clots and strokes and heart attacks. So as we proceed to the panel discussion, for those listening, please note that some community members were provided questions for our panel during the registration process for this webinar. And as we get started, I'm again extremely humbled and excited to introduce our panelists. So the first is Dr. Tina Stefanski. She is the Regional Medical Director and Administrator for the Louisiana Department of Health, Office of Public Health in the 7-parish region of Acadiana. She completed her residency in pediatrics at LSU New Orleans and has been working with the State of Louisiana Office of Public Health for the last 19 years. In addition to her role with the OPH in Acadiana, she also serves as the medical director for the LDH-OPH Bureau of Regional and Clinical Operations. Then we have Dr. Joseph Cantor, who's an assistant state health officer at the Louisiana Department of Health and an administrator and medical director for the Louisiana Office of Public Health in Region 1. Dr. Cantor is an inspirational and innovative public health leader who draws on robust experiences in local and state government, academia, as well as inpatient and outpatient clinical settings to bridge silos, reduce barriers, and work towards a community that's healthier for everyone. Again, extremely humbled, and you can see why. And then we have Dr. Corey Hebert, who's an assistant professor at both LSU Health Sciences Center and at Tulane University Medical Center. He is highly regarded as a medical broadcast journalist, working as an on-air chief medical editor for the NBC television affiliate in New Orleans, and the Gulf Coast on-air contributor to the Dr. Oz Show, CNN, CBS, as well as National Geographic, the Meredith Vera Show, Good Morning America, and the Today Show. Dr. Hebert is the host of Doctor for the People, in which he answers health questions live on air. Dr. Hebert is also the Chief Executive Officer of Community Health TV. So I'm just so excited about all the questions that we're going to engage in. Then we have Dr. Sean Kimberly. She received her medical degree from Louisiana State University of Medicine in New Orleans. Her pediatric residency was completed at the University of Florida in Gainesville. And after 15 years as a general pediatrician physician, Dr. Kimberly joined the Pediatric Hospitalists of Louisiana and ultimately became the clinical medical director. She then advanced to Chief Medical Information Officer for Our Lady of the Lake Children's Hospital, which we all know well. And in 2013, she was named Chief Medical Officer of Our Lady of the Lake, as we said, for now 8 years. And then we have Dr. Kimberly Mukherjee, who is a board-certified pediatrician at Tulane University. She is fluent in Spanish and is the medical director of New Orleans Children's Health Project. She also serves as the director of Immigrant and Refugee Health for the Tulane section of Community Pediatrics and Immigrant Health. She provides general pediatric primary care at the Tulane Children's Pediatric Clinic, as well as at Crescent Care, where she specifically focuses on the complex needs of newly arriving immigrant and refugee children. It's just extraordinarily, and we really thank you for what you do, for what all of you do. And so this is our amazing panelist group today to provide you this information. They're going to help us have a brief but deeper discussion into some of the points we mentioned. And as we start this panel, it's important that we emphasize COVID-19, is not over. We've kind of heard about this Delta variant that happened possibly from really all the hardship that went through India, as it has affected many people in the country. And we must, really do have to remain vigilant as we have and protect ourselves in our community by those things that we mentioned: masking up, physically distancing, being more than 6 feet, washing our hands, or sanitizing if you're unable to wash it. And as soon as the time's ready and you feel right about it, to get vaccinated. Because again, when people say, what happened to flu? It's because it's amazing. These things work when it comes to viral transmission. So let's start the panel discussion. And this discussion, again, will be factual, based in science, and it will be addressing questions parents have kind of shared with us in the medical side, Department of Health and superintendent, that they have in regard to the COVID-19 vaccines. And there's nothing more respectable than wanting to be knowledgeable and comfortable about a decision, especially when it pertains to children. So let me be the first to say, as the moderator of the session, that people have every right to feel that way, and regarding their past experiences, what they read, what they've heard, and especially when it comes to issues on racism, sexism, mistreatment, or injustice. We know these experiences play a part in people, both with their decisions, different populations and communities, that in part affect vaccine kind of hesitancy and trust, but of course into several other areas that we hope to improve on as we build and grow as a community. So my first question to the panel, and this will be, it may seem like a question that'll be saved for later, but it's what do we really want parents to take away from this panel? And I think the first question that's a very important one that I'll ask Dr. Tina Stefanski is it safe for children over the age of 12 to get the vaccine?
Hi. So yeah, that's I think really at the heart of a parent's concerns, right? Is this a safe vaccine for their child who's 12 and older? And absolutely, there's been so much evidence now over these last several months that these are safe vaccines. They're effective at preventing COVID infection, certainly severe COVID infection. But absolutely, parents need to ask that question, should be asking that question. But hopefully, they're comforted by the fact that again, these vaccines have been well studied since the implementation of the COVID vaccination campaigns. We've vaccinated over hundreds of millions of people here in the United States alone, and certainly over 2 billion worldwide. So, hundreds of millions of people have been vaccinated in this country. Lots of safety and efficacy data was reviewed by the FDA Advisory Committee on Immunization Practices, and in May made the wonderful decision to allow vaccination to also occur in children 12 and above. And so again, everyone's most concerned about safety in children, and so we should all be comforted by the fact that we've got lots of great evidence and data behind that recommendation, and it's ongoing. I mean, this is a very intensely monitored vaccine. And just to mention, we talk about safety. Lots of people will hear about some symptoms post-vaccination, and that's really your child's immune system working. And so it's a safe vaccine and very effective in kids. You produce a great immune response. So while children might have symptoms of a sore arm, fatigue, headache, that's their immune system working, and nothing bad. It's what you would expect and hope to see.
Yeah, I think one of the things that on the medical side we talk about is really how extraordinarily statistics-wise the side effects you see compared to really any other drug you give. Beta blockers for blood pressure and all these things have such a high percentage, and it's kind of a medical marvel in that sense. Just if you look at the side effects of the medications you're taking on a daily basis and interventions, how well tolerated it seems to be statistically, and is shown with the numbers that you mentioned. So Dr. Joseph Cantor, if we see the data and we feel that it is safe for children to be able to get the vaccine, tell us why should a child get vaccinated, especially given the statistics about it, being better tolerated in children compared to the elderly population.
Hey, thanks, Dr. Genesia, and really thanks to everyone who's on the panel. Like you, Dr. Genesia, I'm really humbled by the other folks on this call, out of really intelligent, committed individuals. So thank you for joining. Listen, the bottom line to that answer is that your child is at much more risk of getting COVID and having the complications of that than they are about the vaccine. Dr. Genesia mentioned something I want to hit on. If you talk to doctors who treat patients with all types of chronic diseases, they'll tell you that every medicine out there has side effects. I can't think of a medicine that really doesn't. What's happening with the COVID vaccines is, this is all that's on the news. It's all that's been on the news for the past 15 months. So things get amplified. It's an echo chamber. And look, there's been 313 million doses of COVID vaccine administered in the country. I mean, an incredible amount. So like any medicine, there's a small number of side effects, overwhelmingly mild, but the news picks it up and it becomes a thing. I really want to encourage parents, don't fall in that trap. These are incredibly safe vaccines. They're really some of the safest vaccines that are out there. And the side effects, when people do experience side effects, are relatively mild. A sore arm, a little low-grade fever, feeling crummy the day after, just like happens sometimes when you get a flu shot. But the benefits are tremendously greater than that. And there's a myth that COVID doesn't affect children, and that's just not true at all. In Louisiana, we've had 63,000 cases of COVID in children and 8 deaths. And I'll tell you, one of my strongest memories, personally, I'm an ER doc. I practice in New Orleans. And one of the first COVID cases that I cared for back in March 2020, which feels like a decade ago right now, was a 17-year-old high school student who passed away from cardiac manifestations of COVID. He was found dead in the bathroom by his father. These complications are real, and they're not going away. We've turned a corner with COVID. Cases are better, but there's no guarantee they're going to stay that way. We've got this Delta variant out there, which is increasing. We're going into some very warm weather, which is going to drive people indoors and increase transmission. All that's predictable. Doubling down on the vaccines now is the way to protect ourselves. It's how we're going to have a normal summer. It's how students are going to have a normal and safe fall semester, hopefully back to normal. It really is our ticket to normalcy. So I can't encourage parents enough. It's a gift that we have these 3 vaccines that are very safe and effective. Let's take advantage of that. Dr. Genesia, I think you're still on mute on your end.
Oh, thank you. I was saying thank you for that response. And a lot of people say, well, we don't know the long-term effects of a vaccine, but we do know long-term effects of several viruses that, at least on the oncology side with Hodgkin's and Burkitt's, a lot of these lymphomas have chronic viruses that are there that show years later, and shingles and things. So that's something to consider, where in the acute phase, maybe children do better, but over time, you're not sure what the consequences are of a chronic viral exposure. So when we've had so many vaccines and we feel that it's safe and that it's something that is well tolerated, do we have the data to say that it's just as effective for younger groups as adult groups, or is it effective, and how much? Dr. Corey Hebert, if you'd be able to help us with that, is on the effectiveness in children population, and has it been studied?
Actually, don't think Dr. Hebert has had a chance to join yet. If he is, definitely jump in. But I can let you know, Dr. Genesia, that the trials that allowed the FDA to, Dr. Corey Hebert is there. Okay, I'm gonna pause because he's a smarter gentleman than I am. Corey, you want to take that question? He might be having some audio issues, so just jump in when you can, Corey. But I'll let you know, the trials that allowed the FDA to extend the authorization for Pfizer to go down to 12 years of age had 0 cases of COVID in the children who were vaccinated, and there were about 3,000 or 4,000 individuals in that trial, so not a tiny trial, so highly effective. And this fits with what we know about vaccines in general, because children tend to have a more robust immune response, so they get good protection from vaccines. So I think the protection is likely better in kids because they have very, very strong immune responses. There's nothing but benefit to vaccinating a child right now.
Sure. And Dr. Sean Kimberly, on that same note, because children do sometimes have a more robust immune system, we've always been kind of told, like, well, if my child has seasonal or peanut allergies, is it safe because of that? You could have this kind of propagated or faster response to something. Has it been shown to be safe for kids with seasonal and peanut allergies?
Hi, that's a great question, and thank you for asking that. I'm also excited to be on this panel and really appreciate the opportunity to talk with people. So as far as kids with allergies, it's a very common illness, right? We see a ton of children that have both seasonal and food allergies. We've given the COVID vaccine to millions of adults and older teens that have allergies, and we've had no complications at all. So really, children with allergies are fine to be able to get the COVID vaccine. So there's a very small subset of people who may have a severe allergic reaction to a component of the COVID vaccine. There's polyethylene glycol is a specific component that some people may be severely allergic to. And this is the type of allergy I'm talking to is an anaphylactic type of allergic response where you have to use an EpiPen. This is, again, something very serious. So if you have that history of anaphylaxis to polyethylglycine or any sort of component of the vaccine, then please talk with your physician or your allergy immunologist. But in general, we see that the vaccine is very safe for children, and that includes children who have allergies.
Thank you. So in summary, it sounds like the vast majority of children that do have seasonal allergies, fare just fine with the vaccine, and it's a small subset of people that have ethylene glycol or common components found in other things that may have a reaction, and that's something to be considered if there's a history of that in your children. So the next question I'm going to give to Dr. Mukherjee, which is a popular one. It was actually on the Today Show this morning to some extent. The concept of having mandatory vaccines is not a new one. Even in daycare with our children, like the rotavirus and these things, they want to know those. Not, of course, they're concerned about your child, but also to make sure for the children in your classroom. Will the vaccine be added to the mandatory school vaccinations? And what are some of the things that may determine whether this will or won't happen?
Yeah, thank you for that question. That is definitely a great question and a great thing to be thinking about in terms of where are we now, where are we going with COVID rates in children, and how do we protect them? So, I think first of all, to start with, I really want to commend our Department of Education for doing such a phenomenal job of bringing kids back safely to school. And so now we have a new tool in our back pocket, in our toolkit, to really keep kids even safer in school. And that's the vaccine. The vaccine is not currently mandated to return to school in Louisiana. That is going to be a decision made by each individual state should we get to that point. And so our goal right now is to really keep our rates of COVID as low, as close to zero, at zero if we can, for children. And the way to do that is to vaccinate. You're absolutely right that we have many other vaccines that are required for school entry. And I think this is a really important time to remember that a lot of children have really not received their general well care during this pandemic and may not be up to date on some of their just routine childhood vaccinations. So while they're out getting their COVID vaccine, it's really important to get caught up on all of your other vaccinations as well. We want kids to be safe from all preventable diseases, and that includes ones that we have vaccines that are required for school entry.
Thank you. And, kind of on that point where we know that some of the viruses that people can get when they're younger, like Bordetella and whooping cough and rotavirus, they do seem to be more of a problem in a younger population. Dr. Tina Stefanski, can you answer why then, if those are the ones that we really want to focus on vaccination for, where it's problematic in a younger subset, do they really, what is the reason that they would need a vaccine when the data shows that maybe they don't fare as badly as the general population in contrast, and when it comes to COVID specifically?
Sure. So while it is true that most children, have very mild cases, in some cases may have no symptoms at all, if they are infected with COVID, there is still a very real risk for severe infection and complications from this virus. And so oftentimes, when we look at the overall numbers of hospitalizations and cases, it certainly seems as though there are fewer cases and there are severe infection. For each one of those cases, that's a very significant, that should be, it's of course a very significant problem for that child and that family when you've got a child severely ill. So I think for parents to realize that you don't want that to be your child. You don't want your child to be one of those that does have a more severe outcome as a result of this infection. And, we're seeing, as you would naturally expect, as the older population is vaccinated, we're seeing a greater proportion of the newer cases occurring in younger children. So that continues to increase. And recently, it was reported nationally that there was a slight increase in hospitalizations in children after we had seen a decline. So I don't think anyone should count on the fact that typically most people or most children have a mild infection, because I think people do need to realize that there is still a risk for severe infection and outcomes and poor outcomes in children. And we see that, there's been thousands of hospitalizations, deaths, unfortunately, in children. And you just don't want to take that chance. These vaccines are known to be safe and effective. And why take that chance? And I also want to, just kind of mention the fall. It's an unknown this year. Last fall, we were social distancing, masking. We saw, virtually no flu in the state. I'm very concerned about what's the respiratory season going to look like. And I know the panelists who are in the hospital systems and in the outpatient clinics with me on this webinar are concerned about that too. What will this fall look like? And parents don't want their child to be in the mix without being vaccinated. And so I'm hoping that they'll take advantage of, again, these vaccines that are readily available and protect their children now.
Yeah, for sure. And in addition to those kind of more seen complications, there's also just the concept of who they're around, and I've had several patients that say, I swear I haven't been anywhere, and I don't know how I could have gotten COVID. I've been delivering, and presumably it's from, family contact, even if it's a close circle. So
sure. Yeah, and I certainly want to mention that. I mean, of course, that we want to protect your child, but also your child might have a mild or asymptomatic case and be able to spread that virus to someone else unknowingly. So certainly it's, it's to protect your child, but also to protect your community and those individuals that your child might be around.
Right, 100%. So on that same notion, Dr. Cantor, if you're really, driven to want to vaccinate, especially if you have older grandparents around or people with these comorbidities we talk about, what do you do if your children aren't old enough to get vaccinated and yet they're in these kind of, communities or setups where they're, around several other children or individuals?
Yeah, it's a great question. I know it's on a lot of people's minds too. My daughter is not old enough to get vaccinated, and we think about it a lot. I think families need to take a risk assessment of who's in their family, who lives with them, who are they around, what are their risk conditions, and think about how much risk they're comfortable with. I can talk you through some examples of that. My wife and I and my daughter, we don't live with grandparents. My wife and I are both fully vaccinated. We don't have serious medical conditions that would put us at extreme risk. So for us, we think our risk is generally acceptable, and we allow our daughter to go to daycare, play on playgrounds, essentially act like a normal toddler. But I know lots of families that have a higher risk profile. They live with elderly individuals or people who are immunosuppressed, who don't have functioning immune systems, either because they have certain medical conditions or maybe they're getting chemotherapy because they have cancer. And we know that some individuals like that, even if they do get fully vaccinated, if they're on chemo, for example, if they have some other conditions, it might not confer full protection from the vaccine because they're being immunosuppressed. And so they have a higher risk profile. And because of that, they're more careful with what their younger kids can do, who they can be around. I think this is great conversations to have with either your pediatrician or your primary care provider. Talk about who's in your family, what your risk profile is. I'm optimistic that by the end of this year, by the end of 2021, the age of vaccination eligibility will go down even farther. And I hope that my daughter, for example, will be eligible, and I look forward to vaccinating her. But I know that we need to keep that in mind until that happens.
For sure. Yeah, there was a recent publication that came out in the cancer side where lymphomas, things with rituximab and stuff that has to do with autoimmune disease kind of compromises that, because that's a lot of your, B cells and lymphocytes and antibodies. So something to be very mindful about. And as an oncologist, I can say there's a lot more walking around than you would know that are on chemotherapy or at risk. And those effects last, a year plus after even completion or cure of treatment. So with that said, Dr. Kimberly, is there, some people do have a concern with when vaccinating their children, if they have other disabilities, either in the capacity of disabilities physically or cognitively, or even ADD and ADHD medications? Are there some glaring things where it's more concerning to vaccinate a child if they have a something they're battling, atypically? And also, I think your mic, if it's a little far from me, if you could come a little closer, we could hear you a little clearer. Yeah.
Jump in. So that's a good question. And actually, children who have complications or other illnesses that they're battling, it's better that they become fully immunized. As we've been taking care of children in the hospital with COVID-19 infection, the ones that have been pretty sick with it are ones that have other comorbidities, they have other illnesses going on. Or they've been very young children, like under a year of age, they've really had a tough time with it. So I feel it's even more important for children with other illnesses, other complicating factors. It's important for them to get the vaccine. Changes with kids, there are ongoing studies right now that are looking at the dose of the vaccine. Do we need a different dose for younger children? And so that's being studied right now. And really the researchers are trying to determine what's the best dose that gives that immunity, that gets that good response from the patient's immune system to protect them against COVID-19. That lower dose because they're just smaller in size. And so that research is going on right now. And that's nothing different. Like we do use a smaller dose for influenza vaccine, which other kids get a smaller dose. So that's not a new idea. It's just currently being studies that we can find that right dose. But I certainly would recommend any child with comorbidities or another illness going on, whether it's asthma or spina bifida or ADHD. I think all the more important reason for those children to get the vaccine.
Thank you. So it sounds like, as you said, I mean, if it's spina bifida or asthma or ADD, ADHD, those are, it sounds like even more reason to really be vigilant about protecting and not introducing an additional stressor, with a full-on infection, if you can temper that or really make it go away. So, Dr. Mukherjee, I'm going to take that to another aspect that a lot of people are concerned about based on the things in the last 10, 20 years, and that's if a child has autism. Is there any reason that there should be concerns or issues vaccinating a child with autism?
Thank you for that question. As pediatricians, we address this question quite often in our regular clinical practice every single day with other vaccines, with our other routine childhood vaccines. So the first most important point is that there is no link between autism and vaccines of any kind. And so that includes the COVID vaccine. And so that kind of gets at the question of do vaccines, is there a link with autism? And the answer is no. But this question that you're asking is actually about children with autism and if there's any additional risk factors for them. And the answer also is that there are no additional risk factors for children with autism to receive the COVID vaccine. These children should receive the COVID vaccine to achieve the same level of protection as all other children. And in fact, I would argue that children with developmental disabilities, often are the ones that we most need to return to normal activities and normal routines in order to really help, normalize their daily routines. And so being vaccinated is going to be the way that we get to that point. So children with autism should absolutely be vaccinated. And additionally, important to remember, no link between any vaccine causing autism.
Thank you. And being an adult physician, what I've heard is, especially with autism, introducing stressors of like a full infection and things like that can really be difficult and challenging. And so if you could have reduce the chance of those stressors being introduced with a vaccination, that it's 100% across the board, seems safe and no different to a child without autism, it's something definitely to strongly consider. So I'm going to break Dr. Aber in pretty hard with this next question, because I've heard this and I was interested on the data. And it's basically that, well, one, I guess, to start it is, do children experience different side effects from the vaccine than those that are traditionally seen, as we know very well, with millions of vaccines with adults? Do they experience different side effects? But then I'm going to piggyback it with, myocarditis after getting the vaccine. So there have been some reports about basically, this inflammation of the heart tissue following a vaccine in boys specifically. Is it true? And is that any cause of concern for the vaccine to younger male children?
Well, first of all, can I get a thumbs up that everyone can hear me? All right, good. I first of all want to apologize. Life is what happens when people try to make plans. And what we have learned from COVID-19 is that everything is up for debate, folks. And so I'm in this thriving metropolis of Boise, Idaho right now. And I'm sorry that it took me so long to get on, but it was a little bit of a technical glitch. I'm happy to be here. I want to thank everyone for tuning in and for having me. Okay, so let's cut to the chase here about one thing. People don't get vaccinated because they're scared. That's it. And people that are of color don't get vaccinations because they're super scared because of things that have happened to them before. So let's get that started, because the reality is that it's kind of odd that African Americans and people of color get their children vaccinated more than they get themselves vaccinated, which is a kind of an interesting phenomenon. But with your question, we'll go back to that. But with your question, there are going to be lots of side effects to vaccines. And we know the most common side effect for any vaccine really is injection site pain. Your arm's going to hurt. We know that. You're going to have some nausea, some fever, some body aches. That's just like, think about when you want to get biceps like this, right? You want to get these big biceps. I don't really have big biceps. But if you really want to get some, what do you have to do? You have to go to the gym and you have to work out every day. And when you come home from that gym, your muscles are very, very sore. And when your muscles are sore, you're like, well, I know my muscles are sore because I'm working on building my strength. Okay. So when you want to have a strong immune system, when you get fever, that's that muscle soreness. When you get the nausea or the vomiting or the feeling like you don't feel so good for a couple of days, that's that muscle soreness that's causing you to be able to build your immune system. Just like that real muscle soreness is what causes you to build your physique. So there's no pain, no gain, folks, when it comes to vaccination. Your body is going to respond because it's going to do the right thing. It's going to do what it's programmed to do because it sees whatever it gets injected to it as a foreign object. And then it makes antibodies so that if you ever see it again, you'll be ready to fight it. So don't think of your side effect as something bad. Think of the side effect as something means that your body is working to make the muscle bigger to protect you when the actual virus comes to get you. Okay, that's what you got to think about. And you can't think about the fear because we all have fear of a lot of things. But in Louisiana, let's be very, very You eat sausage, that's a class 1A carcinogen. You eat bacon all day. People drink alcohol all day. I mean, you can't divorce things and say, well, some things are bad and some things are good when all of these things have been approved by some governmental agency. We've had illnesses that we don't even see anymore in the last 15 years. Because of vaccines. You may not have heard of a disease called Haemophilus influenza type B, but it used to cause thousands of babies to die, hundreds of thousands of babies to get sick. We have a vaccine, and now some of the younger doctors on this panel have never seen a case of this disease, let alone somebody die from it, and it's because of vaccination. So as we go towards, when you talk about the myocarditis is an inflammation of the heart muscle, and it can happen from anything at any time, from any virus. It just happens. Okay, I mean, we have some people that just will get a common adenoviral cold, which is just a regular URI, your upper respiratory tract infection, and then that virus gets into the heart muscle, and it gets inflamed. The people that actually have had this complication have usually been boys. They've been in the teenage years, and we're not sure yet if it is because of the vaccination or not. Once again, it's a very, very small number, but we're not sure if it came from a cause of the vaccination or not. Always remember, there's causal and there's temporal. Okay, just because something happened after something else doesn't mean that thing was the cause of it. It just means that may have happened anyway. So we're getting all the data points now to make sure that we know that if that's a causal thing, we need to do something about it. If it's a temporal thing, it's going to happen anyway. And I'm going to throw one thing out to you about like causal versus temporal when it comes to this kind of stuff, right? Bell's palsy. Bell's palsy is a neurologic problem where one side of your face starts to droop, basically, after you get a viral infection. So 8 people in the Pfizer trial got, out of 40,000 people, got Bell's palsy. Okay, so that's like, oh my God, you got Bell's palsy after you got this vaccine. But the incidence of Bell's palsy in the United States is more than that. So the odds are you would get Bell's palsy from just getting a viral infection more than you would have gotten it from a vaccine, especially the COVID-19 vaccine, folks. So what I need you to always understand here, and I'm gonna wrap it up and give it to everybody else, you gotta step away from myth, and you gotta trust somebody sometime. It's myself, Dr. Stefanski, all the folks that are on here, that we have shown that we have had boots on the ground to take care of you for a quarter century. So at this point, we know what's coming in the fall. We know that there's going to be a booster. We know that people probably aren't going to get it. We know that people are selling fake vaccine cards right now, that half the state isn't vaccinated. We know that. So if you haven't been vaccinated at all, and then the fall comes and you haven't gotten the booster, the Delta variant and that variant, when it's cold outside, it's going to be back. And we're going to lose more of our culture and our population when that happens. So I'm telling you, what you must do is you need to get vaccinated. You need to get vaccinated today.
Thank you for that. That was very comprehensive and outlines a lot of the important things, especially about the fact that with the vaccine, you're introducing something, whereas a lot of the vaccines before, you actually putting a piece of that vaccine into the body. In this case, you're manufacturing something, this whole RNA concept, you're just manufacturing something to make that piece. So example I use with my patients is we have Genesia ears. So my dad's Punjabi, and so you can tell my brother, my dad, and I have the same ears. So what it looks like in the preliminary literature, and correct me if I'm wrong, but with the Delta variant, a variant is basically the same virus that undergoes mutation to look different. My brother and I, you can tell us both being Genesia boys with our ears. So that fortunately, the same protein that was made with the current vaccine appears that have to have the same ear with the Delta virus. So hopefully as variants evolve, you hope to, maintain that one kind of protein or feature about a vaccine so that you can still recognize it with your immune system. And I can definitely share the same sentiment with associating things. I see the same distribution of cancers and the same number of cancer patients as I always have, and I understand and I empathize. I've gotten a lot of questions like, well, did maybe the COVID vaccine cause this? I had it 2 months ago, but my, the distribution hasn't changed. So it's easy to dissociate, and I've done it myself, but for me, it's very comforting with the statistics and just knowing how extraordinarily really impressive they are on the side effect side and the efficacy as well. So, but to piggyback the myocarditis part and everything, and I hope we can maybe drive this point further, Dr. Stefanski, there's been some questions about children that are extremely involved in athletic activities and their heart rates are going up and they're just, glory days intense as we wish we were at. Did they need some more increased monitoring after their vaccine or anything, or statistically or on the data? Is there any reason to do that, or is it totally fine?
So there's no official recommendation on this. I think, it's kind of back to, back to common sense and monitoring your own health and your own body. And so what I would say is that, after vaccination, if you don't feel that great, if you've got a headache or fatigue, then you probably need to give your body a rest. Take a couple of days off. You might not get back to A-bears. It may take a little bit longer to get those biceps, but take a break from whatever workout activity that you're engaged with, and again, just kind of give your body, your immune system time to get through those couple of days. But other than that, no, there's no reason to limit what you do post-vaccination with regard to exercise, except again, just kind of listen to what's going on and make good decisions. Hydrate, it's hot outside. So rest and hydrate. And then you're going to be, really empowered with an even greater response to that virus once exposed, because that means your immune system, is working really well and building those protective antibodies.
Awesome. And I'm going to give you a twofer just so they can segue to Dr. Cantor. Say a child wants to get a vaccine and maybe their parents aren't as enthusiastic. Is consent from a parent needed for a person under the age of 18 to get a shot?
Yes, and I think a timely discussion, considering today some of these 16, 17-year-olds may want to enroll and try to win something right through this lottery. So children or kids under the age of 18 need parental or legal guardian consent for vaccination, and so that needs to be, hopefully parents will again educate themselves, arm themselves with the best information, and support that adolescent's interest in protecting their health. But yes, parental or legal guardian consent is required for immunizations.
And I'm hoping, these conversations and getting this data, and you all as experts can help placate those concerns. But Dr. Cantor, for those that still may have some reservation, which will hopefully be resolved at the end of this panel discussion, but if they do, honestly, and this vaccination is required by federal officials, what is some of the guidance you may have to kind of navigate those waters should that happen?
Yeah, that's looking pretty far ahead. And just to be clear, the COVID vaccines are not required really by anyone right now. They're not required by the feds. They're not required by the state of Louisiana. Down the road, when they move from emergency use authorization from the FDA to a normal approval, which takes some time, I think schools might think about it, states might think about it. I really don't know what's going to happen here, to be honest with you. But right now there is no requirement to get vaccinated. There are a lot of benefits. We've talked about a lot of the benefits here. You get peace of mind, you get protection, you get the assurance that you are not going to unknowingly spread the virus to someone else, or your family gets protection. And now, as Ms. Hood mentioned, you now get a chance to win some of $2.3 million of lottery prizes and scholarships for younger individuals too. So there's a ton of benefits out there. Meeting some requirement really, particularly for children, is not why they're going to get vaccinated right now. There's the myths that are out there, and Dr. Aber mentioned, some of these. There's no substitute for talking to your doctor, talking to your pediatrician, your primary care provider, or whoever it is that you trust with medical help. There's so many myths out there, and almost all of them are just totally bogus. So if you do have remaining concerns or questions, I really encourage you, sit down with the pediatrician, talk it over, talk about what concerns you. That's the best place to get facts and also advice that's tailored to any specific situation you might have.
Thank you. And you touched on it, and Dr. Aber, I'm gonna give you this one, because if it's not your biceps, your calves seem quick on your feet. The biggest question I get, and we're getting this question actually during the panel, is and I would like you to kind of reiterate this point, if a group of people that are said to have the strongest immune systems, like we mentioned, children, especially with some reports saying that, a quarter to half of children may be immune or have been exposed to COVID-19 and not known it. The question is, why should those that strong immune health and possibly exposed group of population or demographic get the vaccine, whereas some argue, well, it should be reserved for those with compromised immune systems only, or some reason to suspect that it may be more of an issue? Well, maybe they were too fast and he ran away.
There we go.
There you go.
Yeah, so one thing we have to remember is that we are going to get to herd immunity, okay? The reason why we use vaccination, folks, is that we need to get to herd immunity faster, because the faster we get to it, the less the amount of people that are going to die. But when we had the Spanish flu, which is a misnomer, by the way, because it didn't start in Spain in 1918, the point is we actually got to herd immunity because we're still here. We got to herd immunity, and there were no vaccines because a lot of people had to die for that to happen. So we have vaccines so that we can get to herd immunity quicker, so that we can decrease the death toll. So if we didn't vaccinate kids who are super spreaders, who go everywhere, who talk really loud, who spit on everything, who play with everybody, who goes to the grandfathers, the grandmothers, If we don't vaccinate them, all it's going to do is make us have herd immunity to take longer than it would have regardless. Also, children have very strong immune systems. They do. But when they get sick, they kind of get really sick. And we don't want that to happen because, contrary to popular belief, I mean, every life is important. When an old person dies, everybody cries, okay? But when a baby dies, people freak out. All right. And that's just the reality. And I don't know why that is, because everybody has a life and everybody's life is important. But babies, when children die, it becomes people take things a lot more seriously. So we need to vaccinate the kids so that they don't come home and give it to people that may have been vaccinated and the vaccine didn't take very well, or people that can't get vaccinated because they had bone marrow transplant, or they had some other type of illness, or they have some type of immune problem. So we want children to be vaccinated so they won't get sick and they won't transmit the virus to other people that could actually get them sick, that actually may be people that are compromised. And one thing that is very important also here is that when we look at the amount of total people that are going to be needed, that need to be vaccinated, folks, you know, we can no longer just sit back and say, I'll let someone else do it. In Louisiana, we have a very interesting culture. And I will tell you, we have lost music. We have lost recipes. We've lost stories. We've lost just the bulk of so much just raw information and culture because these older people have died. And people don't even want to see their grandchildren because they're scared they're going to die. The only way around this is to vaccinate young people and old people and middle people and everyone so that we can get back to normal.
Thank you. I think that's a sentiment, you know, a lot of us share, that have seen kind of the hardships and damage that was done, you know, during the front lines of 2020 and continue to happen now. So this is a great question. Now, if I got it a few times, we'll go with Dr. Kimberly. Tell us, somebody that's listening on the panel asked, does it matter if our child is vaccinated at their pediatrician's office, or is one of the community vaccination sites just as well safe and indicated?
That's a great question. Can you hear me okay?
Yeah, this is better. Yeah.
That's a great question, and thanks for whoever asked that. Thanks for listening and posing that question. And absolutely, you are fine in bringing your child to your pediatrician's office or your provider's office to get the vaccine. We've loosened up a little bit on some of the requirements as far as the very beginning when we had the vaccine. We wanted to use every single dose that we could squeeze out of that vial. Now we have more vaccine available, and so now we want to get as many kids vaccinated and as many adults, as many people vaccinated as we can. And so now primary care doctors' offices, many of, including the pharmacies and hospitals and many other settings, is where you can really get that vaccine. So we're not as strict on using every single dose in that vial. Our goal is to get it out to as many people as possible. But it's a reliable vaccine that your doctor's office suggests, and it's a reliable vaccine at the community center. So please feel comfortable in getting that vaccine with your primary care doctor.
So it sounds like it's totally, you know, one and the same, regardless of where you get it at. And I know our our state has really been vigilant about providing those opportunities. They have little drives at the mall, and they'll give away gift cards just to really incentivize protecting our community, which is awesome. And at one point, Uber was even giving free rides. You can check your local site and see if that's still available, just because it's that important for all of us. And I didn't think, as Dr. Aber said, about the culture that does die when you lose people that are a fundamental part of what I think is one of the most enriched states in the country for culture and for centuries of preservation. So I think we've hit most of the points. Is there anything that's pressing that you guys really want to share? You guys, astute women, I'm sorry, I have a thing, but that is really important for everybody to know and to kind of consider, and something you may have been seeing in your office that's very important to address?
I'd like to say something, Doc. I mentioned it earlier, and I think, as a Black man in this state, I take care of 99% of a Medicaid population, and Black people in this state in the city of New Orleans as well, have earned mistrust of the medical establishment. Everything from the Tuskegee experiment to just, using Black people for guinea pigs in clinical trials to, you name it, right? But I get that. I get that. But what we have to know now, okay, is that this vaccine wasn't rushed. This vaccine was pushed because we needed it, okay? This vaccine, the data for this vaccine to be able to be manufactured has been looked at for over 15 years. This vaccine, they say it's not a vaccine, okay? People talk about semantics when it comes to this. And I literally I was playing a tennis match 2 days ago and literally had a lady who was very smart, African-American lady, tell me that she is scared because she thinks that there's going to be a zombie apocalypse from all the people that got this vaccine a few years from now, and everybody's going to turn into zombies. Now, I want to say that because this woman didn't say this to me in jest. She said this to me in a way that made me feel for her because she was scared and she was nervous. But what I will say is that everybody on this panel, from Joe Cantor down, is out there fighting for you so that you can make sure that you have access to this vaccine. Unlike the access you've had to medical care since Black people were brought to this country, we fight for you every day so that you can have access to primary care. We all should give a big clap because Obamacare, once again, was voted in that it wasn't going anywhere by the Supreme Court. So these people on this panel in the Louisiana Department of Health, we fight for you. So for us to be able to make sure you can get the vaccine, you need to respect me enough and this panel enough to please go get the vaccine. You have to trust somebody at some time. And if you can't trust the folks that are here, then you shouldn't go anywhere. You shouldn't go anywhere. So please get vaccinated so that we can get back to our regular, normal lives and you can thrive the way you were before.
Thank you. I think all of us share that same sentiment. Well, I want to personally thank all of the panelists. And again, I'm just so inspired and humbled for everything you've done for our community. Being a Baton Rouge boy, we've been here my whole life and came back to practice enthusiastically, and especially to everyone listening and engaging and wanting to know. I don't think there's anything more respectable from the medical side and the medical community about any individual than wanting to know and be educated and share that knowledge. That's why we do what we do, is to learn and to have the data and to educate the best we can to empower you with ultimately your own decisions for you as an individual, your family, and your community. So I'm going to pass it over to Devondra, and I think she's going to wrap up. And again, thank you all so much.
Thank you.
Thank you all very, very much. Wow, that was a wonderful panel discussion, so rich with information and medical knowledge from all of you medical experts. Thank you, Dr. Genesia, Dr. Savansky, Dr. Cantor, Dr. Hebert, Dr. Kimberly, and Dr. Mukherjee. Thank you so, so much for all of the information, your responses, and for being a part of this especially important panel discussion. As community gatekeepers and medical providers participating in this discussion, each of you has helped to enrich our people, populations, and communities' awareness, and you've possibly empowered others' readiness to further protect themselves, their families, and their communities from COVID-19. We thank you. Once again, we want to make sure that you all walk away with these important takeaways. Information, knowledge is key, right? Make sure that you're getting accurate information regarding these shots and getting them from credible sources like LDH and your physicians and nurses, community health workers, people that really know this information related to COVID-19. Vaccinations, that the vaccinations are available to you and everyone over the age of 12, and they are safe and effective. You have access to them. Make sure that you reach out and you get them. And then prevention, even though the restrictions are starting to decrease and go away, As the doctor said today, masking up, social distancing, physical distancing, and washing your hands is protecting us not only against COVID-19, but against other viral infections. So making sure that you are still preventing transmission is so important. So those are the takeaways we want to make sure that you walk away with. Most importantly, I want to make sure I thank all of the attendees for coming and listening to the discussion today. I hope that you found something enriching and valuable that you can take back, along with the takeaways to add to your discussions with your families and within your communities, because at the end of the day, we are all in this together. Please utilize the resources that we have supplied. You can share all of the information that was shared today. A link to the webinar, as well as the one-pager you see here on the screen, will be sent to attendees of tonight's webinar. So please make sure you share them throughout your community. There's also a link to a toolkit there that'll be placed in the chat, as well as the link to the Shot in the Million campaign and a link to the COVID information on the LDH website. So please make sure you use those resources and you circulate them. Before we go, I'd like to thank the staff of the Office of Community Partnerships and Health Equity and the Bureau of Media and Communications for executing such a needed conversation for our parents. A huge thanks goes to the entire Louisiana Department of Health team, as well as the Louisiana Department of Education for collaborating on this event. And last, but certainly not least, a special thank you to our Secretary of Health, Dr. Courtney Phillips, for her continued leadership in addressing COVID-19 issues within Louisiana. This last slide there, I'm sorry, you can go back to the slide with the Bring Back Louisiana. That's our Sleeves Up campaign. This is definitely one of our statewide initiatives that is across the state. So please make sure if you have any questions regarding that campaign, you call our toll-free number at 1-888-543-0774. With that, I'd like to end tonight's webinar. Thank you so much for attending, and you all have a great and wonderful evening.